Today's topic is going to be outer knee problems, that dreaded IT band problems that all us runners experience. Capitol Hill Running Club, been doing this for many years. Had 4 bouts of IT band problems over the years. We're going to go through a few exercises today with Sarah, who's going to show you guys how to tackle these IT band issues when you do get them, what to do about them, and how to stretch and strengthen your way out of these problems. All right, pass it on to Sarah. So what Sarah's doing right now is she's targeting her quadricep, but her lateral head, the outside part of that quadricep, right where that fascia meets the IT band. So you have a crack, so to speak, a crack space that is separating the IT band from the quadricep. And that's what Sarah's working on right now. It's called your fascia. And the fascia is a piece of connective tissue that connects really your foot all the way up to your skull. And that fascia is what separates the IT band from the quadricep. So what she's doing right now is she's stripping out that fascia. You can't do a whole lot with the IT band as far as rolling on it. It's a very strong band. You could actually hang a car from that IT band, so rolling it isn't going to cut it. So by stripping out the fascia, so to speak, she's going to loosen up that whole area on the outside part of the knee. So right now she's rolling on that little crack space in her fascia, and she's doing something called windshield wipers, which is something that we have most of our patients do with IT bands. So you can see her bottom leg, she's swiveling it, she's moving it, she's kicking her leg, and what she's trying to do is separate that fascia. So I'll have her do this for about 2 minutes before a run as a way of getting blood flow into that muscle. And then she'll flip onto her back and she'll start foam rolling her fascia between the hamstring and the IT band. Same thing, trying to separate those two muscles so they're not pulling. She's breaking up the adhesions that she's developed from years of playing rugby, years of being a runner. She typically will run on the high or the low side of the street if she runs the same route every day. If you ever look at a street, you'll see that the center of the street is higher than the sides of the street. So you develop these repetitive stress injuries. Getting your leg lengths assessed is very, very important as well, especially if you are running the same route and one leg is on the high side of the street and one leg is on the low side of the street. We'll talk about that in another video. But again, what she's doing is she is stripping out the fascia in between her hamstring and her IT band. And she'll do this for about 2 minutes, and she'll do this every single day before her run and after her run. She wants to get blood flow into the area before her run, and she wants to strip out the tension or the tightness after her run. Okay, so she's going to do a little bit more windshield wiping on that leg, and windshield wiping again is to strip out the adhesions between the two muscle groups. Okay, so about 2 minutes on that. Good job on that, Sarah. Okay. She's going to walk over now and she's going to grab her loop band, L-O-O-P, loop band. We bought these on Amazon, and she's going to start with some monster walks. She'll put the loop bands right above her knees, and she's going to start strengthening her hip muscles. So for you runners out there, the knee is totally protected by the hips. What are your hip muscles? Your glute medius, your glute maximus, your glute minimus, your piriformis. Those muscles are the #1 protector of your knee. Without good strength in your hips, you will not have stability in your knees, and you'll be setting yourself up for knee injury. So part of Sarah's routine every single day is to do her monster walks. So she's going to the right. She's got a nice little baby squat in her, and you can see the bend in her knee right now is about the same amount of bend in her knee when she's running. So she's actually strengthening her knees in about the same angle, the same position that she's running in, and she's strengthening her hips, her glute medius, her glute max. She's doing some piriformis strengthening in there, and she'll do this for a good solid 2 minutes. Okay, Sarah's a top-notch rugby player. She's been with the national team. She trains every single day. She doesn't want to get knee injury and take her out of the game, so she is very, very concerned about strengthening her hips, as she knows that is the #1 protector of her knee. You could see her feet are pointing straight ahead. She's got a good lumbar curve. You can see that curve in her low back is preserved. It's strong, it's maintained. She's got good head position. She's keeping herself nice and strong. She's doing exactly the type of work that she's trained to do. If you don't have a loop band, you can grab yourself a jump stretch band. This is a medium weight green jump stretch band. Again, we bought these on Amazon. We use them every single day. She's going to do something called X walks. So she'll cross the band and she's going to do the same movement that she did with the loop band. So this takes the place of the loop band, because the loop bands are a little bit weak. They're not as sturdy, not as hardy as these jump stretch bands. So Sarah's strong. She can maintain her form, and she can do some good strengthening with these X band walks. She's going side to side, and again, she'll do these for about 2 minutes prior to working out as a way of warming up, and also as a prehab or a rehab exercise. All right, we're going to move on to side laying clamshells, another excellent exercise to strengthen the hips. This time she's going to be strengthening a little bit more of the smaller muscles of their hip, the piriformis muscles, the obturator externus. These are all little muscles that we never really think about, but stabilize our hips, stabilize our low back, and again, stabilize our knee when we're running. Again, we're talking about how to prevent outside knee problems in runners. So strengthening the hips is key. Foam rolling. And Sarah, where do you feel that?
She feels it right here.
She feels it right on the outside part of her hip. Excellent. Again, about a 2-minute duration on this. And she'll do this on both sides. All right, we'll come back in another video and we'll talk a little bit more about how to prevent runners' injuries. Good job today, Sarah. High five.
Thank you, Dr. Moses.
Thank you.